So we report a lot on the impacts of climate change, from extreme weather like the rain in California to severe tornadoes down south and wildfires across the Northwest. And now we are learning the impacts of climate change may cause longer, more severe allergy seasons. And for the 60% of American adults with at least one chronic condition, this may intensify threats to their health. So joining us live this morning with more on the risks and ways to protect your health is Dr. Neha Pathak. Dr. Pathak, good morning to you.
Good morning. Thank you for having me.
Well, it's good to have you. How does climate change impact people with chronic conditions?
Well, climate change affects all people, but people that have chronic conditions. So I want you to imagine and think about 10 adults that you know. We know that out of those 10 adults, at least 6 have one chronic condition. And if you think about what climate change is doing in our world, so extreme temperatures, heat domes, tornadoes, just like you said, it's really hard to stay healthy mentally and physically in a world that's changing like that. And if you add a chronic condition in the mix, it's even harder to maintain your health.
So what can folks be doing to better protect themselves?
So I'm a primary care doctor, and I also focus on lifestyle medicine. And my research is really looking at ways that the prescriptions that we're giving patients to protect their health from chronic disease can also protect the health of the planet. So first, I think it's really important to think about a plant-based diet. We hear this all the time. We can really think about it logically. The more healthy foods we're eating, so that's whole food, fruits, vegetables, whole grains, and the less food that we're eating that is more dangerous to our health, like unhealthy fats, sugars, salts, processed foods, is going to protect us from heart disease, diabetes, weight issues. So we kind of know that piece already. But what a lot of people don't know is that there are huge climate benefits to eating a diet like that. So we know that if you were to produce 1 kilogram of beef, that's 60 kilograms of greenhouse gases that we're putting in the air, not to mention the land use and the water use. If you were to shift that to 1 kilogram of a plant-based food like peas, let's say, that's 1 kilogram of greenhouse gas or 1 kilogram of peas produced. So we were talking 60 to 1 greenhouse emissions when we shift towards a plant-based diet.
It's a really interesting point that you bring up there, because when we talk about climate change, saving the earth, I mean, that's a massive thing, but you're talking about teeny tiny little incremental things that we can do individually that can make a big difference.
Absolutely. Well, you know, I think thinking about saving the earth is a big, big, big problem. We need to be thinking about saving ourselves, protect our health, protect the health of our children and our loved ones. So doing simple things like shifting our diets, which we know the evidence supports is going to protect our health. We now have lots of evidence to show that that's going to protect the planet as well. Another thing I would say is physical activity. So a lot of us know that the more we move, the healthier we are. If you can imagine, scientists have also looked at research to look at how that affects local pollution and greenhouse gas emissions. So they've seen that if we think about some local trips that we do just in our neighborhoods. So for example, I walk my daughter to school. It's about a mile trip. And so now I'm taking my car off the road. I have less greenhouse gases going into the air, less local pollution, and I'm getting a lot of physical activity. So just thinking about ways you can incorporate a little bit more physical activity for day-to-day errands that you're running in the neighborhood and have a huge impact as well.
Yeah, I get that. That's a great way to think about it. Dr. Neha Pathak, thanks so much for joining us. Appreciate it.